योगः कर्मसु कौशलम्।
Namaskar. I welcome you all to this webinar of stretching. Stretching is an integral part of every sportsman's training program. No sportsman can go without stretching. We all know the benefits of stretching. Stretching is performed as a part of warm-up, is performed as a part of cool-down, is performed for relaxation and for numerous other reasons. Every sportsman knows the significance of stretching. Why do we stretch? Basically, the two reasons we should stretch is one, to reduce the chances of injury and to maximize the performance, which every sportsman, irrespective of the sport, would always want to achieve. Stretching, if defining stretching, stretching is a therapeutic maneuver which is used to elongate the tight soft tissues, so as to establish the normal range of motion. In certain conditions, the range of motion required is more than the normal. For example, in gymnast, in ballet dancer, in karateka, judo player, etc. It's everybody's dream to have a kind of flexibility shown by the gymnast. The more the flexibility you have, the better the chances of your performance, force production, and lesser the chances of injury. So every sportsman knows the significance of stretching. If I have to say about stretching, this is how we define stretching. Okay. So we want the hypomobile tissues to be stretched, to be normal, and in sports like gymnastics, etc., we want the tissues to be extended beyond the limit, beyond the normal limits, normal established range of motion. So how do we perform stretching maneuvers? This is a weird question. I mean, everybody will be thinking, stretching is a normal routine procedure. So what's new in that? Over a period of time, observing the academy in various academies where sports are conducted, I have often seen the stretching program being carried on by the coaches, by the players on each other. So how the stretches are performed? Let's see an interesting video how the stretches were performed, are performed and should be performed. स्ट्रेचिंग करेंगे तो ऐसी फ्लेक्सिबिलिटी आएगी। क्या सही में फ्लेक्सिबिलिटी आएगी? टिश्यूज विल टियर अपार्ट, फट जाएंगे टिश्यूज अगर हम ऐसे स्ट्रेच करेंगे तो। सो अगेन so should we perform stretching like this? I don't think so. Forceful stretching do not serve purpose at the minimal of the level required. And how the stretching should be performed. Now this is a movie video, and you might not agree with that you do like this. I have a video from a gym wherein the players are performing stretching on each other, opening up the adductors. And how do they do that? So this is how the stretching is performed in lot many academies by lot many players, by the sports person on each other, by the coaches. And let me tell you, this is not the correct way. And what is the correct way and why this is not the correct way? For that to understand, I will take you to some theoretical aspect about the stretch reflex. So what is stretch reflex? हमने सुना होगा players के बारे में, उनके रिफ्लेक्सेस काफ़ी शार्प है. Maybe while playing table tennis or badminton or even cricket, while playing a fast bowler, you need to have a very sharp reflex. A goalkeeper would need to have a very sharp reflex so as to block the ball. So what is a stretch reflex? What is reflex? Reflex is something which happens automatically. अगर हमें कहीं चोट लगती है, कोई इंजरी होती है, what we do? We immediately pull the body part away. वो रिएक्टिवली हो जाता है, हमें सोचना नहीं पड़ता है कि यहाँ दर्द हुआ, मैं हाथ खींचूं, पैर खींचूं, वो ऑटोमेटिक हो जाता है क्योंकि एक रिफ्लेक्स आर्क बना हुआ है. जैसे मैसेज जाता है कि कुछ गड़बड़ हो रही है, तुरंत मैसेज आता है कि खींच लो, और ये मैसेज जाना वाला भी इतना फास्ट होता है कि आपको एहसास होगा कि आप सोचते नहीं है कि ऐसा करूँ या नहीं करूँ, वो हो जाता है. There are numerous receptors, sensors I would rather say, in more layman's term, in the body. बहुत सारे सेंसर है बॉडी में, और ये सेंसर्स मैसेज ले जाते हैं, और जो मैसेज आता है उसको डिकोड करते हैं और अप्लाई करते हैं. तो स्ट्रेच रिफ्लेक्स क्या है? स्ट्रेच रिफ्लेक्स इज अ प्रोटेक्टिव रिफ्लेक्स. Protective means it's activated so as to protect the tissues of the body, the muscles of the body which are being stretched beyond a limit, or where the tension in the muscle increases beyond a limit. तो ये कैसे होता है? In every muscle there are sensors inbuilt. तो जब मसल की लेंथ चेंज होती है beyond a limit, या एक स्पीड से ज़्यादा मसल की लेंथ चेंज होने लगती है, टेंशन बढ़ने लगता है मसल में, तो तुरंत मैसेज जाता है स्पाइनल कॉर्ड में. यहाँ सेंटर स्पाइनल कॉर्ड है जहाँ से रिस्पॉन्स आता है. तो मैसेज आता है कि बहुत फास्ट खींच रहा है मैसेज, तुरंत वहाँ से भी रिस्पॉन्स आता है कि रोको, ब्लॉक और रेजिस्ट द स्ट्रेच. मतलब अगर आप खींच रहे हैं जबरदस्ती या फोर्सफुली या बहुत स्पीड में, तो क्या होगा? वो जो मसल जो आप खींचने की कोशिश कर रहे हैं, द सेम मसल इज ट्राइंग टू रेजिस्ट दी पुल, resist the stretching. So what happens is the purpose for which you are stretching is not getting served. हम खींच रहे, जोर मार के खींच रहे हैं, लेकिन वो खींचेगा नहीं, क्योंकि हम खींचने की कोशिश कर रहे हैं और मसल रोकने की कोशिश कर रहा है, क्योंकि उसको डर है कि ये अगर इस स्पीड से खींचा जाएगा, और if the tension increases beyond a limit, the muscle will tear apart, and maybe if not the whole muscle, lot many muscle fibers will get damaged. So the muscle will resist the stretch. This is something very important to understand by every person who performs stretching. That if the stretch, the speed of the stretching or the intensity of the stretch is beyond a particular limit, you will not achieve the purpose of stretching. Maybe adding to that, you might injure the muscle, you might injure the soft tissue structure by overstretching. There are chances wherein the person stretching might be able to overcome the muscular resistance, and if that happens, that will definitely result into injury. Very commonly happens in children. I mean, when the stretch is applied by some adult to the children, because the children's muscular forces might not be strong enough to resist the stretching force, ultimately it will lead to injury. It will lead to muscle tear. So what we need to understand is, if we activate the stretch reflex, which is being activated if we stretch the tissues at a high speed or at high intensity, we will activate the stretch reflex, and that will block the stretching, that will prevent the tissues to get elongate, to lengthen, and the purpose of stretching will not be served. So always keep this in mind. We will come to the next point, and how to stretch. Okay, in the principles of stretching, how do we stretch? Before going further, we will have a look at another graph also, so as to understand how the tissues will react when you stretch, and to what limit should we stretch. So this is a stress strain curve, and a stress strain curve, as you see, a stress strain curve is for all the structures, say, all the elastic structures or all the structures which will yield. Now we will speak more specifically for the muscle tissues, muscles and soft tissues of the body, and we relate this graph to that only. So our tissues are elastic in nature. Most of the tissues, say, and definitely muscles are elastic in nature. That is, you stretch and you get stretched. Then what is elastic? I mean, what do you understand by the elasticity? Any tissue or any structure you stretch, and on releasing the stretching force, the tissues will fall back into its original position. That is the elasticity. आपने खींचा, छोड़ दिया, वापस उसी की जगह पे आ गया, तो टिश्यू लेंदन नहीं होता है, वो खींचता है, वापस सिकुड़ के अपनी जगह पे आ जाता है, जैसा था वैसे हो जाता है. So that is the elastic property of the tissue. What is plasticity? प्लास्टिक देखा होगा आपने, प्लास्टिक की बैग देखी होगी, थैली. अगर आप प्लास्टिक को पकड़ के खींचोगे तो एक बार खींच गया, उसको खींच गया, वो वापस अपनी पोजीशन में नहीं है. सो व्हाट वी वांट टू अचीव, we want to take the elastic tissues into the plastic region. जो इलास्टिक स्ट्रक्चर्स है हमारे मसल्स, हमारे सॉफ्ट टिश्यूज, उसको हमें खींच के प्लास्टिक रीजन में ले जाना है. सो व्हाट डू यू सी इज द यील्ड पॉइंट. तो अगर हम किसी टिश्यू को खींच रहे, वो धीरे धीरे खुलेगा, स्ट्रेच होगा. उसके बाद हम जब उसको प्लास्टिक रीजन में ले जाएंगे इस पॉइंट के आगे, then it will move to the plastic region. So what happens when we take the elastic tissue to the plastic region, the tissue will establish a new range, a new position. वो खींच गया जो टिश्यू प्लास्टिक रेंज में, वो वापस से जैसा था वैसे नहीं होगा, उसकी लेंथ बढ़ जाएगी, जैसे प्लास्टिक का मैंने बताया आपको. So how this should happen? You would have seen the rubber bands used by females, hair bands, बालों में डालती है. Initially it's a very small round circular thing. Over a period of time when they use it repeatedly, it widens up, खींच जाता है. वैसे हमें टिश्यू को स्लोली खींच के प्लास्टिक रीजन में ले जाना है. अब खींचना है, that doesn't mean that you stretch it anyhow. If you stretch it beyond the point, that is beyond the failure point, it will result into injury. हमको कैसे पता चलेगा कि फेलियर पॉइंट आ रहा है अगर हम स्ट्रेचिंग कर रहे हैं तो? So the pain tolerance is one thing which will tell you about that okay, this is the point you should stop. ऐसा नहीं कि खींचोगे तो दर्द नहीं होगा, लेकिन वो दर्द कितना सहन कर सकते हैं, और सहन कर सकते इसका मतलब नहीं कि कितना भी सहन करो आप खींचते ही जाओ. You have to gently proceed point by point so that you do not break the tissues. So always focus on gentle stretching, okay, taking the tissues into the plastic region and to establish a new range of motions. So if you follow this procedure in the stretching program, in your stretching training, you will always have a better muscles and soft tissues after stretching. And stretching has lot many benefits, as I mentioned. Apart from increasing the range of motion, the chances of injury will reduce, the performance will be more better. Okay, lactate washing out of the lactate will be more faster and more easier. Soreness post activity will comparatively reduce or will not come up. So you have to follow these procedures when you are performing the stretching maneuvers. Now, principles of stretching. So what are the principles of stretching? तो स्ट्रेचिंग करने के लिए हमें क्या ध्यान रखना चाहिए, कौन सी चीज़ है जो हमें फोकस करनी चाहिए स्ट्रेचिंग करते वक्त? So first and foremost important thing is alignment. I'll show you what we understand by alignment. मतलब if you align the things, the tissues, the muscles and the joints in the right way, and then we apply the force such that the force is directed to the appropriate muscle group, performing the desired range of motion activity, then you get better results. Because body is multi-segmented, बहुत सारे joints हैं, और muscles, एक muscle शायद 2-3 joint पे काम करे, ऐसा भी हो सकता है. So if you do not align the body parts in the right way, you will not get the stretching of the desired tissue. वो मूवमेंट कहीं और हो जाएगी. So alignment is very important. Along with that stabilization. अगर हम कुछ खींचते हैं, अगर मानो मैंने रबर पकड़ा हुआ है और मैं खींच रहा हूँ, if I stretch like this, I am stretching. That is, I have to stabilize one end. और एक पार्ट, एक छोर को पकड़ के फिर खींचूंगा तो खींचेगा. दोनों भी ऐसे खींच सकते हैं, लेकिन उसकी लिमिट है. बॉडी में ऐसा दोनों साइड से एक साथ खींच नहीं सकते. So we stabilize one part of the attachment of the muscle, and we move the other part of the attachment of the muscle. So if the muscle is attaching on two different bones, that is what usually happens, is crossing the joint. We stabilize one of the segment of the joint, and we move other segment of the joint so as to gain the range, to improve the range or to stretch the tissues. So alignment and stabilization is very important, or rather that is the first and foremost thing you should check when you perform stretching. I'll show you the photo for this. Then the intensity of stretch. So just let's see. Okay, now here you could see the alignment and disalignment. We can make out looking at this alignment that this is not the right alignment. Okay, and now the procedure is to stretch the hip flexor muscles. Hip flexor muscles are these are the hip flexor muscles. You are also going to stretch the knee extensions along with these. But if you are not stabilizing your pelvis, as it is over here, the pelvis is not stable. If you do not stabilize the pelvis, and if you do not align the foot in the right direction, the knee rather, the thigh in the right direction, this is not aligned. So stabilization is not there, alignment is not there. If you do not stabilize and if you do not align, you are not going to get the right stretching. I mean, when you are stretching over here, what you are doing is you are causing a movement at the back. You are not going to get the stretching of the hip flexor muscles. So when you do not align and stabilize correctly, you are not going to achieve the results. Let's have a look at another picture also. You could see the back is not stabilized over here, the arm is not aligned properly as like here. So the same thing over here. So there is no alignment, there is no stabilization in this photo, you will not get the stretching of the tissues. So you are stretching the shoulder extensors over here. Okay, so stretching and alignment is very important. Then intensity of stretch, magnitude of the stretch force applied. कितनी ताकत लगानी चाहिए, कितनी जोर से खींचना चाहिए. So as we discussed in the stretch reflex, the intensity beyond the limit will prevent the stretching to occur, stretching of the tissues to occur. The muscles will rather resist the stretching. So stretching should always be low intensity stretch. It should always be a low intensity stretching maneuver. It should be a low intensity stretch so that the muscles knows that okay, this stretching force is not going to cause any injury to me. So they will gently allow the lengthening. The muscle will relax and will allow you to stretch. So always remember, whenever you stretch, it has to be low intensity stretch, low intensity. Keep in mind low intensity. Forceful stretching, as we saw in the first two videos, is not going to help. It's rather going to cause injury. So never force stretching. खींच के जोर मार के कभी स्ट्रेचिंग नहीं हो सकती है. स्ट्रेचिंग एकदम आराम से ही होगी. मसल रिलैक्स होगा तभी स्ट्रेच होगा. तो रिलैक्स नहीं है तो स्ट्रेच नहीं होगा. So it has to be always a low intensity stretch. Duration of stretch, that is how long are you going to stretch. So ideally the stretching should be continued for about 10 to 30 seconds. I will say ideal stretches will go for about 30 seconds. And maybe 3 stretches of 30 seconds each, if performed about 5 to 6 times a day or after every workout, will serve a good purpose. Now, not necessarily that only after workout, you perform stretching even before workout, that is during the warm-up. So there are different types of stretch which you employ in the warm-up and in the cool-down. So static stretches are usually applied in the cooling down period, that is after the workout when the muscles are contracted a lot and shortened, you apply static force to lengthen out the muscle which is shortened by contraction and relax the muscle. Dynamic stretches are usually performed in the pre-workout, that is in the warm-up period, so as to get the muscles and the joints ready for the movement you are going to perform, for the activity you are going to perform, for the squats you want to get involved into. So you would have seen people performing various dynamic stretches, say a cricketer walking into the ground to bat will move like this is bat, like this, the bowler will rotate his arm. So those are the kind of dynamic stretches. So duration of stretch is ideally about 30 seconds, 3 stretches of 30 seconds each. Perform usually, if not in the workout, otherwise 5 to 6 times a week, at least 5 times a week, 3 to 5 times a week, will serve the purpose to stretch the tissues and open up the range of motion. If it is more about the tightness of the tissues. This we saw and we spoke about. Mode of stretch. So how are you stretching? As I mentioned to you, static, we are applying static force. Static forces are continuous forces applied. Okay. There can be static progressive force. That is, we applied some force, we waited, then we applied some more force, that is gaining the range, and then we waited, then we progress a little more. So that is static progressive. There can be dynamic stretch, as I mentioned, that is stretch is performed with the movement. The difference between static and dynamic stretch is, in static stretch we don't move. We hold the joint position in a particular angle and we stretch the tissues, like 8 position. And static stretches, if you speak about, lot many yoga asanas are example of static stretching. काफ़ी सारे आसन जो हम करते हैं, आप चाहे पद्मासन ले लीजिए, आप चाहे पुष्टिमोत्तानासन ले लीजिए, आप चाहे ताड़ासनी करिए, तो आप चाहे हलासन करिए. So these are static stretches, and yoga asanas are an excellent way to stretch the tissues. We do it by ourselves, we apply it on the patients, we apply it on the athletes, and we have seen wonderful results. So I will always suggest that you should always include yoga asanas in your training regime as a part of stretching. Then there are dynamic stretches, which are performed with the movement. Then there are ballistic stretchings. Ballistic stretchings are usually part of training wherein you want to improve the range of motion, you want to improve the motor control, you want to improve the joint positioning, you want to improve the power, you want to improve the proprioceptions, etc. So ballistic stretching will involve more bouncing, more repetitive, forceful activities. So we'll get that to the ballistic stretchings also later on. And cyclic stretches perform repeatedly at intervals. You stretch, you relax, you stretch, you relax. More often performed with the mechanical devices. Then degree of participation. So what is the degree of participation? Whether passive, assisted, active. Passive means done by someone else. For example, the sport person, the player is lying down after the activity, or before or during the activity, and the physiotherapist will stretch the tissues. Or maybe the other player, the co-players will perform stretching on each other. So those are performed by others on a person are passive stretches. Assisted can be self-assisted. Say for example, if I am stretching the triceps like this, I am stretching this tricep. This is assisted stretching, I am self-assisting. So assisted stretchings can be self-stretching also, which we do. There can be self-stretching, active self-stretching also. अगर मैं खुद ही खींच रहा हूँ without assistance, this is active self-stretching. जैसे हम hamstring stretching करते हैं नीचे पैर पकड़ने के लिए वगैरह. Active stretching मतलब active मतलब जो खुद करते हैं. Active self-stretching भी होता है और हम खुद अपने टिश्यू स्ट्रेच कर सकते हैं. Source of stretch, that is the forces. Forces can be manual or mechanical. Manual मतलब हाथ से ताकत लगा रहे हो, या तो अपने हाथों से ताकत लगा रहे हैं या कोई और अपने पे ताकत लगा रहा है स्ट्रेच करने के लिए. So the sources can be manual and mechanical by assisted devices, by mechanical devices. There are devices which are used to open up the splits, that is to stretch the adductors. Okay. Speed of stretch is very important. If the speed of stretching is greater than beyond the limit, it will activate the stretch reflex, as we spoke in the stretch reflex. So आप किस स्पीड से स्ट्रेच कर रहे हो बहुत ही इंपॉर्टेंट है. एंड द स्पीड हैज टू बी वेरी लो एंड जेंटल. इंटेंसिटी लो, स्पीड लो. If you perform the stretching keeping in mind these things, you will definitely get good results. So always perform slow and low intensity stretching activities. Frequency of stretch, that is number of stretching sessions per day or per week. So usually 3 stretches per muscle of 30 seconds duration will serve a better purpose and usually perform 3 to 5 times a day as per the requirement. And the one who performs routine workouts, they will perform it before and after the workouts also. So these are the principles of stretching and you should always keep this in mind while performing the stretch. अगर ये दिमाग में रहेगा तो स्ट्रेचिंग के फायदे आपको बहुत अच्छे मिलेंगे, आपकी रेंज अच्छे से खुलेगी, इंजरी के चांसेस बहुत कम हो जाएंगे, रिकवरी फास्ट होगी, सोरनेस होने के चांसेस कम हो जाएंगे. सो आई ऑलवेज suggest that we should always keep these principles in mind. We should always keep in mind the stretch reflex, that we should not activate the stretch reflex. Stretching करते वक्त stretch reflex activate नहीं हो, और वो तभी नहीं होगा जब हमारा स्ट्रेच बहुत ही स्लो और लो इंटेंसिटी है. स्लो मतलब एकदम धीरे धीरे से, मतलब आप उसको खींच के नहीं ले जा रहे हैं. If you are performing a slow stretch, gentle stretching, say for example, if I have to stretch this muscle, if I am doing this gently, with a slow stretch, okay, beyond the, within the tolerance limit, I am doing it okay. So take care of these things. Keep in mind the principle of stretching whenever you perform the stretch maneuver. Types of stretching: static stretching, dynamic stretching, cyclic or intermittent, ballistic and PNF technique. तो स्टैटिक और डायनामिक स्ट्रेचिंग हम सारे करते हैं, बैलिस्टिक स्ट्रेचिंग भी बहुत सारे करते होंगे. PNF या प्रोप्रोसेप्टिव न्यूरोमस्कुलर फैसिलिटेशन टेक्निक्स जो है, these are usually applied by the physiotherapists and this also gives good results. So I have discussed with you the static and dynamic stretches, so even the cyclic stretching and ballistic stretching. Let us have a look at what this type of stretchings are. Rather than going deep into theory, let's have a practical demonstration. So static stretch, just it's a stretching of the muscle to the point of mild discomfort. Okay, थोड़ा सा खिंचाव आ रहा है जो सहन कर सकते हैं. Hold 10 से 30 सेकंड करना है. Repeat the stretch 4 times. Usually 3 times will do. Flexibility exercise sessions should occur 3 to 5 times up per week, as we discussed. Example of static stretch. So all the sports persons should be performing this kind of stretching techniques. Right. So this should be pretty clear to you what are static stretches. हम सब करते हैं और करना भी चाहिए रेगुलरली, तो इंजरी के चांसेस काफ़ी कम हो जाएंगे. So that was an example of static stretch. Just a minute. I think I just missed to play the video. तो आपने देखा ये स्टैटिक स्ट्रेचेस काफ़ी सारे, इससे भी काफ़ी ज़्यादा है, और इसमें काफ़ी सारे योग के आसन भी आपने देखे होंगे. So this is how we go with the static stretches. Then dynamic stretching, so that involves repetitive bouncing movements. If performed excessively or beyond control, may lead to muscle injury and soreness. So dynamic stretching has to be performed carefully and usually preferring the warm up compared to the cool down phase. So this is the dynamic stretches. Let's have a look at the dynamic stretches. So we saw the dynamic stretches, and you might have been performing these kind of stretches in your training programs. Okay, and usually they are done in the warm-up phase so as to get the body free to move during the activity. Then the ballistic stretching. Ballistic stretching is a rapid, forceful, intermittent, high speed and high intensity stretch. Now ballistic stretching, as the name suggests, is ballistic in nature, that is, it involves high speed and high intensity stretch, and these are more dangerous than the dynamic stretches. I mean, there are greater risk of injury involved in performing ballistic stretch if it's not done carefully or properly, because there are vigorous bouncing movement which forces the body segment beyond its range of motion to stretch the shortened structures or maybe to elongate the structures beyond the normal range. And it's difficult to control and can lead to injury in weak tissues. So always take care that you perform the dynamic stretches with a lot of care, otherwise you might injure yourself. Let's see a demo of how the dynamic stretching, your ballistic stretching is performed. So this is an example of a ballistic stretch, and there will be lot many other plyometric activities which will be performed. Plyometrics are again high intensity, high frequency, high velocity activities, and that will also involve the ballistic movements. So, but I would always suggest that do this very carefully, otherwise you might injure your tissues. Sorry. Then PNF stretches, that usually involves isometric contractions and normally performed with a partner, and this will be well performed by the therapist. So you can do it once you understand there will be involvement of isometric contractions, isometric that is static contractions, and followed by the movement so as to gain the range. And a PNF technique by therapists will be more beneficial. So that was about the stretches. Now we usually focus on stretching the muscles and the soft tissues. So other than the muscles, there is one particular soft tissue which has an immense effect on the body and the movement. And movement can be restricted. अगर रेंज खुलती नहीं है, मूवमेंट पूरी नहीं होती है या ज़्यादा नहीं होती तो हम सोचते हैं मसल टाइट है, लेकिन मसल के अलावा एक और चीज़ है फेशिया. ये आप जो वाइट वाइट देख रहे हैं ये सारे फेशिया है. फेशिया क्या होता है, मतलब अगर हम सिंपल लैंग्वेज में बोले तो फेशिया इज अ कवरिंग. जैसे पैकिंग करते कोई चीज़ को तो जैसे कवर करते हैं उसके ऊपर, वैसे ही फेशिया है. और फेशिया सारी चीज़ को कवर करता है, मसल को, मसल फाइबर्स को, सॉफ्ट टिश्यूज को, सबको फेशिया कवर करता है. सो फेशिया इज अ काइंड ऑफ से होल सूट. पूरा अगर हमने जैसे सूट पहना हो, अगर सूट टाइट है तो हमारी मूवमेंट अच्छे से नहीं होगी, वैसे ही फेशिया का है. इफ द फेशिया इज नॉट freely mobile, it will impede the range of motion, it will impede the activity, it will restrict the movement, और उसकी वजह से आपका परफॉर्मेंस अच्छा नहीं होगा, आपकी रेंज नहीं खुलेगी. तो शायद आपको लगेगा कि यार मसल्स टाइट है, लेकिन मसल्स को खींचने से कुछ नहीं होगा. फेशियल स्ट्रेचिंग इज वेरी इंपॉर्टेंट. और कई बार मतलब फेशिया ऐसा है कि बहुत सारे सेंसर्स है बॉडी में, बहुत सारे पॉइंट्स है. आप अगर किसी पॉइंट को टैप करोगे तो इलेक्ट्रॉनिक आइटम जैसा बटन दबाया काम हो गया वैसा. फेशिया भी अगर आप कोई पॉइंट प्रेस करोगे तो आपका फेशिया रिलैक्स हो जाएगा. और फेशियल रिलैक्सेशन इज वेरी इंपॉर्टेंट, और उसके लिए मायोफेशियल रिलीज करते हैं एक्टिवली. हम खुद मायोफेशियल रिलीज फोम रोलर से कर सकते हैं. फोम रोलर इज अगेन अ गुड टेक्निक टू रिलीज द फेशिया. और अगर आपने फोम रोलिंग की होगी तो आपको शायद ऐसा हो कि शुरुआत में जो पहली बार कर रहे होंगे या फिर वर्कआउट के बाद करते होंगे तो काफ़ी सारे पॉइंट्स आएंगे ऐसे जहाँ बहुत दर्द होता है, जहाँ फोम रोलर वहाँ से घूमता है, कि वो सारे ट्रिगर्स है शायद जहाँ पर आपको प्रेशर से दर्द महसूस होता है. और जैसे ही वो पॉइंट रिलीज हो जाते हैं तो आपको काफ़ी अच्छा लगेगा. सो दिस आर द डिफरेंट टेक्निक्स ऑफ फोम रोलिंग. Okay, stretching like say stretching the neck muscles, releasing the neck muscle, I would say myofascia of the neck, the adductors, the calf, the back, the upper back, latissimus, glutei, quadriceps, and lateralis, quadriceps lateralis, vastus lateralis. So ये सारे हम IT बैंड पे फोम रोलिंग नहीं करेंगे. IT बैंड इज अगेन अ डिफरेंट थिंग. उस पर अगर रोल ज़्यादा करेंगे तो शायद इन्फ्लेम हो सकता है या कैन कॉज अनइवनेस. इसके अलावा दिस इज व्हाट यू यूजुअली एम्प्लॉय टू रिलीज द फेशिया. और फेशियल रिलीज होना बहुत ज़रूरी है, नहीं तो मूवमेंट डिस्ट्रिक्ट हो सकती है. मसल फ्री होंगे, फेशिया डिस्ट्रिक्ट करेगा आपको पता नहीं चलेगा रिस्ट्रिक्शन क्या कर रहा है। तो फेशिया रिलीज करेंगे तो ऑटोमेटिक फेशिया रिलीज ऐसा है कि मसल आप स्ट्रेच करोगे तो मसल को स्ट्रेच होने में नहीं आने में टाइम लगता है। अगर मसल टाइट है, आज आपने स्ट्रेचिंग शुरू की ओवर अ पीरियड ऑफ टाइम, मे बी अ वीक, 10 days, 15 days, तो आपकी रेंज खुलेगी। बिकॉज यू कैन नॉट स्ट्रेच द मसल ऑल ऑफ सडन एंड इन अ डे, जैसा हमने आगे बात की। बिकॉज इफ यू डू दैट यू आर ट्राइंग टू इंजर द टिश्यू। बट फेशियल रिलीज इज इंस्टेंटली, मतलब आपने फेशियल रिलीज किया, आपको इमीडिएटली लगे हाँ रेंज खुल गई। एंड से लेट मी गिव एन एग्जांपल फ्रॉम योर पोजीशन, एदर स्टैंडिंग और सिटिंग। अगर आप बैठे या आप खड़े रह के करेंगे तो बेहतर है। जस्ट ट्राई टू रोटेट लाइक दिस। अगर आप रोटेट करते हैं अपने आप को ऐसे, तो जब आप रोटेट करते हैं ऐसे, आप देखिए कि आप कितना पीछे जाके देख सकते हैं, आपकी गर्दन कितनी पीछे जा रही है और कितना पीछे का पार्ट आप देख रहे हैं। उसके बाद आप यूं कर लीजिए, दोनों हाथ यूं रख लीजिए और हल्के से ऐसा आप 15-20 बार कर सकते हैं। और ये करने के बाद आप देखेंगे कि ये करने के बाद आप दोबारा देखिए, आपको लगेगा कि आपका रोटेशन रेंज बढ़ गया है। बिकॉज द फेशिया कवरिंग दिस पार्ट, दिस मसल्स ऑफ रोटेशन हैज बीन रिलैक्स। तो फेशिया रिलैक्स हो तो इंस्टेंटली आपकी रेंज बढ़ जाएगी, वो आपको महसूस होगा। मतलब ऐसे और भी तरीके हैं, लेकिन एज अ स्पोर्ट्स पर्सन this is something you usually do, foam rolling for the facial release. Okay, and I'm including this because stretching is not only about the muscle, or movement restriction is not only about the muscular tightness, it's also related to the facial tightness or facial restrictions. तो अगर फेशिया रिलीज हुआ तो आपकी मूवमेंट ऑटोमेटिक और इमीडिएटली मतलब खुल जाएगी, आपको ऐसा होगा हाँ अभी रेंज बढ़ गई है। तो फेशियल रिलीज जरूरी है, और फोम रोलिंग सब करते ही है, स्पोर्ट्स पर्सन ज़्यादातर लोग, और करना चाहिए। उससे आपके फेशियल रिलीज होंगे तो आपकी मूवमेंट और अच्छे से हो पाएगी। इसके अलावा एक और चीज़ है न्यूरल ग्लैंड्स। मतलब व्हाट इज न्यूरल ग्लैंड्स? यू विल बी नोइंग देयर आर नर्व्स इन द बॉडी। ओके, द नर्व्स इज काइंड ऑफ इलेक्ट्रिकल वायरिंग ऑफ द बॉडी which carries on the message from and to the brain to the different body parts. So there are lot many nerves, and the nerves are again encapsulated in fascia, and they are within, they are under the muscle, over the muscle, within the tissues. तो कई बार ये न्यूरल टिश्यूज जो है उनकी मोबिलिटी अगर रिस्ट्रिक्ट होती है तो भी मूवमेंट खुलती नहीं है। और हाउ यू विल फाइंड आउट व्हाट इज रिस्ट्रिक्टिंग is therapeutic activity. So the therapist, physiotherapist would be a better person to judge about what is the cause of restriction and what manuals to apply so as to increase the mobility, improve the mobility. So one is muscles and soft tissues, another is fascia, third is nerves. अगर हम nerves को mobilize करते हैं थोड़ा सा, तो nerves mobilize करने से भी instant range बढ़ जाएगी। So that will be identified by the therapist whether the nerves are not moving freely, and he will then try to mobilize the nerve, and you will see instant release in the motion. Range automatically आपकी थोड़ी बढ़ जाएगी। I will show you a video wherein what you start with is, आप जैसे खड़े रह के पैरों के अंगूठे पकड़ने की कोशिश करिए, घुटना सीधा रह के देखिए आप कितने नीचे जा सकते हैं। स्टैंडिंग खड़े खड़े नीचे झुकिए, अंगूठा पकड़ने की पैर का कोशिश करिए। हाउ डाउन कैन यू गो, हाउ मच डाउन, यू नोट दैट कि हाँ इतना नीचे जा सकते हैं। ओके, देन गेट अप इन द पोजीशन अगेन, खड़े हो जाइए और देखिए वीडियो मैं दिखाता हूँ, वो प्रोसीजर करिए और दोबारा फिर चेक करिए, तो आपको पता चलेगा कि रिस्ट्रिक्शन अगर न्यूरल टिश्यू का था तो नर्व्स को मोबिलाइज किया तो इंस्टेंट रेंज बढ़ जाती है। सो let it be here. So from standing position, touch the toes of your foot. उसके बाद ऐसे खड़े रह के So first check how much you can go down, whether you are able to touch your toes or how much ever you are able to go down. Then perform these repetitions shown in the video for 15 to 20 repetitions, and then again relax and try to touch the toes again. And you will feel that, oh, if the neural tissues are tight, you will see instant increase in the range of motion. You are able to go down more easily. So there can be three factors which can restrict the mobility. One is muscles and soft tissues, another is fascia, and third is the neural tissue. So focus on these things while performing stretching. Stretching is very important, and even though everybody knows stretching is very important, still there are instances that people, rather the sports persons, miss out on the stretching aspect. Warm up कर लिया, workout हो गया, cooling भी थोड़ा कर लिया, but then for any reason if they miss the stretching of the tissues or the muscles, then the range will not open up. And if the ranges do not open, that is directly going to affect the performance, and that might increase the risk of injury. So hopefully you have understood the basic concepts of stretching, and you have enjoyed this session of stretching. I request you to keep in mind the principles of stretching while performing the stretching activities. You also try to mobilize release the fascia, and you can also try to mobilize the nerves. You can take the expert guidance of the physiotherapist when you require it. Thank you.